How are flu tests done? Have you ever wondered how healthcare professionals determine if someone has the flu? Flu tests are essential tools in diagnosing influenza. They typically start with collecting a respiratory specimen, which is usually taken from the nose or throat. This sample helps detect the presence of influenza viruses in the body. There are two main types of flu tests: rapid antigen tests and molecular tests. Rapid influenza antigen tests, sometimes called rapid influenza diagnostic tests, are designed to detect specific proteins, known as antigens, found on the surface of flu viruses. These tests are quite convenient as they can provide results in about 15 to 30 minutes. You might find them used in clinics or even at home. However, it's important to note that while they are quick, they are not as accurate as molecular tests. This means they can sometimes miss infections or give false positive results. On the other hand, molecular flu tests are more sensitive and accurate. They work by detecting the genetic material, or RNA, of the influenza virus. Rapid molecular assays are a type of molecular test that can deliver results in under 30 minutes at healthcare facilities. More comprehensive laboratory tests, like reverse transcription polymerase chain reaction, or RT-PCR, may take longer, sometimes up to several days, since samples are sent to specialized labs. RT-PCR is considered the gold standard for flu diagnosis due to its high accuracy. When it comes to collecting specimens for testing, healthcare providers typically use a nasal swab, a nasopharyngeal swab, which goes deeper into the nasal passage, or a throat swab. Some studies have looked into using saliva samples, but nasal or nasopharyngeal swabs are still the standard for reliable detection. Other testing methods do exist, such as viral culture and serological assays, which detect antibodies instead of the virus itself. However, these methods are mainly used for public health surveillance or research, rather than immediate clinical diagnosis because they take longer and do not provide timely results for treatment decisions. In clinical practice, healthcare providers choose the type of test based on the setting, the need for speed, and the required accuracy. Rapid molecular tests are often preferred over rapid antigen tests, especially for hospitalized patients, to ensure accurate diagnosis and appropriate care. In summary, flu testing involves collecting respiratory samples and using either antigen detection or molecular techniques to identify the influenza virus. Molecular tests offer the highest accuracy for diagnosis, making them the go-to choice in many healthcare settings. If you suspect you have the flu, it is always best to consult a healthcare professional for proper testing and guidance.